Well, hello back and welcome back, dear viewers. And as you know that in recent years, Kuwait has made great strides in medical education, developing strong national programs that meet international standards. One key success is that of Kuwait Orthodontics Board, which has trained a new generation of skilled Kuwaiti specialists without the need to study abroad. This reflects Kuwait's commitment to advance healthcare system and sector and to build local expertise. Join us today on Good Morning Kuwait, Dr. Hussain Alshatti, orthodontist consultant and faculty member of the board, to discuss the program's growth and how Kuwait continues to keep pace with global medical progress and standards. So, welcome Dr. Alshatti on Good Morning Kuwait.
Thank you so much, and good morning everyone. And I would like to thank you all for the kind invitation, and I'm more than happy to join you.
Well, it's our pleasure, Doctor. So we need to talk more about the board, orthodontists, and to see how it's expanded and it grow in Kuwait. So let's take the first perspective of our interview and to save time. So let's talk about the program and how it was established and from where it's started to where it's going in the future.
Okay, so the Kuwait Board of Orthodontics, or the K.B.O, works under the umbrella of KIMS. KIMS is basically Kuwait Institute of Medical Specialization.
Yes.
So the idea was to develop training programs here in Kuwait, reducing the need for the young dentists to go and study abroad.
Yes.
So the K.B.O was actually established and put into application 2 years ago in 2023. So it's about 2 years and a half that we started, and nowadays we have about 11 training dentists.
So, Dr. Alshatti, in your opinion, do you think that Kuwait has lifted this, let's say, a new and mature program to go base with international standards? As you know, they are developing rapidly.
So, basically, we come into real life 2 years ago, but the idea was there from a long time ago. I would say about 8 to 10 years ago. A big shout out to Dr. Fawzi Al-Qatami, Dr. Salman Sarho, Dr. Ayman Ammar, and Dr. Sayed Al-Ajmi. They worked really hard to establish the best curriculum for this program. So the program meets the international standards that you would find in any different global program.
Okay. Doctor, I have just one question. As you know that, let's say, the Ministry of Higher Education and the Ministry of Health is trying to expand, let's say, the expertise of, let's say, local or national generation. So do you think the board has reduced the need to go abroad to study for such a specialty?
I would say that's correct. With one of the aims of the program is actually to reduce, if not eliminate, the need to travel abroad to study. Living in your country, you can study and you can basically get training to treat the community according to the norms and standards of the community.
And also the needs of the community.
Sure. When we used to study abroad, we used to treat the patients there according to the needs and let's say the standards and norms of the different population. But here in Kuwait, we can study in a much better way the demand and needs of the community and hopefully deliver the best service to them.
Well, do you think, also another question about your opinion, do you think that the board just lifted and elevated the reputation of the board? As you know, let's say the dental sector in Kuwait is thriving. In every neighborhood there is a dental clinic. Let's say also the governmental sector, dental sector, is also providing amazing services. Do you think that the reputation is also continuing to scale?
I would say yes. If we look at the bigger picture, the Kuwait Board of Orthodontics is just a small part of a bigger piece. It's not only orthodontics, but under KIMS, the Kuwait Institute of Medical Specialization, recently we have so many different training programs in dentistry, including orthodontics, that's to do with the braces, including endodontics, that's to do with root canal treatment, prosthodontics, so that's like the cosmetic treatment, replacement of missing teeth, and also recently the oral maxillofacial program. All these programs meet the standards of different universities around the world, like in the States or the UK or Europe. So I think we are on par with these universities.
Universities and also the international standards.
Yes.
You know, we can say that the advanced countries pay, let's say, great attention to the oral health. Exactly, but here in Kuwait there is, let's say, an increasing pace regarding oral health. But we finished talking about the administrative aspect of orthodontics and the board. Now let's take about the operational.
Sure.
The dental. So from your own perspective as a dentist and orthodontist, from which age parents should be concerned or to be concerned and pay attention to their children if they need braces?
Yeah, okay, so the need for braces, it depends what you need of, of them. Many people think that the need of braces is just to make the teeth straight. Yeah. That's not the case. Orthodontics is actually the study of orthodontics and dentofacial orthopedics, which means the correction of the bone as well. So at certain ages, the orthodontist can fix the problems with the bone. So we really advise that the first visit for an orthodontist should be around the age of 7. The reason is that because around the age of the 7, the bone of the upper jaw, what we call the maxilla, usually matures around that age. So if we notice some sort of underdevelopment of that bone, we can intervene or interfere to fix that problem without the need for surgical procedures in the future.
Exactly.
Now let's say the child has missed this kind of inspection or examination visit, then there's a good chance that in the future they will need to go for surgery.
Okay, let's assume that a late intervention, what are the precautions or what are, let's say, the negative side of, let's say, late intervention?
Okay, so to be honest, most of the cases, there shouldn't be any big deal. However, a small percentages, I would say 20 to 30%, will have some sort of problems that are not just mainly teeth, but as I said, problems with the bone. So if the problems with the bones are not detected early, then they will end up maybe needing some sort of surgery, whether be it a major surgery or a minor surgery. Sometimes they will have to remove some teeth to fix their problems with their teeth. So if you interfere early, sometimes we reduce the need for extraction of teeth in the future or eliminate the need for the surgical procedures in the future.
Okay. What are the most common, let's say, problems that you see as a doctor in your clinic?
That's a tough question, I would say.
Yes, I need stories.
In the field of orthodontics, there are several malocclusions. Malocclusions basically means the problems with the teeth and bone. I would say from my expertise, from what I treated, I've noticed many young patients having a small lower jaw. Yeah. So I always go on social media, encourage the parents to bring their children early, because if we notice this problem, we can simply give them a small appliance, they wear it in the mouth, and that will promote the growth of the lower jaw or the mandible. So it will be fixed in a very simple tool without needing surgery in the future. Yeah. And then when they grow up later on, when they need normal braces, the treatment time for them will be much less and it will be much faster to finish and get a very nice smile.
Okay, doctor, if the child or the patient is not treated properly, is this going to affect other, let's say, aspects in life, let's say facially or in the way they talk? Is there any side effects?
There is some sort of connection because the way we talk, some letters we say, it depends on the relation between the tongue and the teeth. So some patients have what we call open bites, so the front teeth are not touching. They might have some lisping issues. Also in terms of function, they might not be able to chew properly, to cut the food. So if that's not fixed, that will kind of affect their social life and quality.
Well, okay, we have a very interesting question.
Sure.
Let's talk about the treatment, how it's developed in recent years. We need to know what are the steps also of treatment from the first time they enter the clinic till they reach, let's say, this glamorous Hollywood style.
Okay, sure. So many people used to the normal braces, the metal one, the brackets, we put them on the teeth, put the wires and make your teeth straight. I would say the two major breakthrough in the field of orthodontics recently are the clear aligner therapy, or the so-called Invisalign. Maybe
Yes.
you heard about it. So it's basically like a very clear braces. You remove it and you wear it on your teeth. So the advantage of that is that actually many adult patients, they refuse to have braces metal because they say, oh, I'm that old, I'm not going to have metal in my mouth. So that increased the acceptance of the treatment now with adults. And also with the clear aligner therapy is that the fact that you don't have to go to your dentist every month. With the metal braces, you have to see your orthodontist on a monthly basis. But with the aligner therapy, you can see them once every 3 or 4 months. And the treatment time will be similar, but your visit will be less to the orthodontist. And it's like more hygienic. You can clean better. You can eat normally without the risk of having the braces to break. So it's a good tool, I would say, in our box.
Okay, and now I have a very interesting question. Who is more visit? Let's say in terms of visits, men or women, young or adults?
Okay, I'll be honest with you. I work in the government sector, in the Kuwaiti board, and I work in the private sector as well. So, in the government sectors, because mostly we do like the conventional braces, the metal one, I will see mostly young patients, teenagers. In the private sectors, I mostly see adult. It's about 50-50, males and females. They come more to the private sectors because they're looking for the clear braces, the Invisalign braces, because it's more convenient based on the age.
Okay, so we are reaching our, let's say, the end of our segment. Do you have any final advice for our dear guests and future patients as well?
In terms of orthodontics, I would really encourage the parents to get their kids to the orthodontist or even the dentist at the age of 7, especially when they see the first permanent tooth coming out, which is the back molar tooth coming out into the mouth. That should be when you see an orthodontist. And for our young dentists, with the Kuwaiti Board of Orthodontics, you are more welcome to join. Now you can pursue your dreams here in Kuwait.
Well, thank you very much, Dr. Hussain Alshatti, for joining us in Good Morning Kuwait. And I hope that my dear viewers also take the advice from our specialist here. So we're going to take a break right now, and then we're going to move to see our next break, next report. So stay tuned.